Hi everyone, I'm Dr. Madhumita. You know me as MedicoMadhu. Today we are going to talk about a very important topic, HMPV virus. As you all know, HMPV virus has now come to India as well. The first case is detected in Bangalore in an 8-month-old baby. HMPV basically is nothing but Human Metapneumovirus. So this is a viral infection. And who are the people who are going to be affected because of this virus? Well, it mainly targets children less than 5 years of age. That doesn't mean the adults are safe. If you are someone who is immunocompromised, what do I mean by immunocompromised? Let's say your sugars are uncontrolled. You're someone who has cancer or you have some autoimmune disorder. You have, let's say, you're undergoing dialysis or you have just received an organ transplant. All these are the conditions where your immunity is low. Even pregnant women, for that reason, have slightly low immunity as compared to their normal self. So anyone who has low immunity or who hasn't formed adequate immunity, like the children less than 5 years of age, are the ones who develop HMPV infection. HMPV was first found in Netherlands lab in the year 2001. So they found it. That doesn't mean it was not there previously. What do I mean by they found it is basically they had seen it in samples which were stored. So this has been there in the air. It manifests similar to that of respiratory syncytial virus. So what are the symptoms with which you can present? You will present with fever. You might have a runny nose. You might have sore throat. You might have recurrent cough episode. It can progress further to involve lower respiratory tract as well. When I say upper respiratory tract to lower respiratory tract, it's not just your nasal cavity and your throat, even ear infection is common. So you might have a middle ear infection. The child might complain of pain in the ear or block sensation in the ear with a runny nose, with pain in the sinus areas, or might say that he or she has difficulty in swallowing. This can progress lower down to involve the lower respiratory tract, presenting with wheezing, presenting with shortness of breath. They can end up having viral pneumonia as well, which can result in respiratory distress. That is, they have low saturation, low oxygenation, requiring further medical care. The child might end up in ICU with respiratory distress or respiratory failure, in which case we might have to intubate the baby as well. It is not only for children, it is for anyone who is immunocompromised. How are we going to detect it? Well, we will be taking the swab, we would be sending it for a PCR, we would be doing some serology, we would be doing an ELISA. All these things would be done by us to detect it at the earliest. How are you going to help us? It is by preventing. The main reason for this talk is prevention. Because once a child has developed a respiratory infection, treat it like any other respiratory infection. Give adequate medication, rest, fluids. Give the baby paracetamol as soon as the baby develops the fever. As and when he develops a nasal block or a ear block, immediately use the decongestant. Make the baby rest as much as possible. Absorb the symptoms that the child is presenting with. Supportive care is the main one. Once you notice that the saturation is falling down, just like during the COVID times that you had been using a pulse oximeter, even in this case, you will have to observe the saturation if the baby is not recovering or the baby is complaining of chest discomfort. X-ray might not be very useful and it is not even recommended in the early phases. Once the child becomes severely ill, we ourselves will suggest you to go for CT scan. So you don't have to worry about those things. So when we realize that the child has pneumonia, we will be starting the baby on ventilator. We will be giving the baby oxygen therapy and other supportive cares that are required in the hospital. From your side, the minute you notice that the child has fever, with chills, with runny nose, with any of the symptoms that I had mentioned previously, first put the mask on the baby so that he or she is not spreading into someone else. Keep the baby away from any other sibling at home or anyone who is elderly, who is immunocompromised, or a pregnant woman over there. The baby has to be adequately hydrated, adequately rested. The minute you notice a dip in saturation, you have to alert and you have to take the baby to the nearest medical care facility. Whether there is a need for antiviral, we would decide and we would be giving. We request you kindly not to do any of these things on your own. Just give supportive care to the baby and prevent the infection from spreading to someone else. Don't worry about the schooling. If your child has respiratory infection, whether it is HMPV, COVID, RSV or not, it doesn't matter. you keep the baby at home, keep the baby isolated. The person who is handling the baby has to repeatedly wash the hands, should wear a mask. You can keep the cutleries of the baby separate so that it is not transmitted to someone else through the saliva. You also have to make sure that the baby's clothing are also washed separately to prevent any droplet infection, any discharge from the baby's clothing transmitting to someone else while handling it. It is not that it is going to transmit immediately with just, the baby's clothes, but it is better to be safe than sorry later on. It usually takes within a week for the baby to recover. Majority of them are non-fatal. Only very rare cases becomes complicated, but it spreads very fast. So it is only to prevent the spread. You all must have read in the newspaper that this 8-month-old baby has not traveled anywhere. We don't even know if this strain is the same as the one in China or not. This can be less transmittable, less virulent, that is less toxic to the community, or it might be something much more severe which spreads very fast as well. So it is always better for us to take adequate precautions than to wait for it to affect us in large number like the COVID wave 2. Let us all work together and prevent the infection from spreading. Good day.